Good morning, everyone, and thank you for joining us for another episode of Insights from the Couch with Dr. Anamaria Ryan and myself, Yalily Smith, owner of The Traveling Therapist. Today, we actually have a topic that was picked by Dr. Anamaria, so I'm really excited about being the collaborator on this one. And it's going to be all about the workplace, about self advocating in the workplace. It's going to be about speaking up for yourself. So when you have certain needs that maybe your workplace can be supportive of you on, and how you can get maybe some tips, some ideas on how to talk to your bosses whenever you have those needs, so that you don't feel like you're so alone and you have to handle everything entirely on your own. Dr. Ana Maria, I'm going to let you get started with the topic, and I will happily follow through.
Yes, good morning, Jalili. It's good to meet with you again. I really look forward and get so excited every time I know we're going to be doing this. So I had been thinking that a number of my people that come to see me, they talk about occupational wellness, which is an extremely important part of our lives. We spend so much time working, and we got to make sure that it is a good fit for us. We're a good fit for the workplace, and not only for those people who may feel like they do have a diagnosis in terms of mental health, because we all have something going on at a certain time in our lives. We really need to make sure that we speak up and we communicate correctly with the employers. So I guess that our topic this morning would be regarding mental health in the workplace. On your end, we would love to hear what it looks like for a business owner and, of course, a therapist.
Mhm.
And I guess on my end, I can give some insight regarding what I have noticed in terms of individual counseling with people that are in need to find more balance in the workplace with the mental health.
Yeah, I definitely, you know, when you spoke about this topic, I had so many different angles because has both, like you mentioned, has both a business owner and has a therapist. I see both sides of the spectrum. One of the things that, I mean, opening up immediately with a big one is our borderline and bipolar patients. So, our bipolar patients, I've had experiences where I've had to sit down with the patient and create a safety plan and create a plan of treatment that surrounds the idea of, like, okay, how can you advocate for yourself and reach out to your employer and seek support, because there's a very good possibility that you might have moments where you might be manic and you might behave in a certain way that's not common or that's not approved in the workplace. And you should know what is available to you, if you can take, FMLA, if you can take medical leave for yourself, things like that. Because what if you do have to be Baker acted? What if you have to take, 4 or 5 days off because you have to rest and get through the manic episode, and maybe increase your therapy, maybe increase your visits to the psychiatrist? So that's a big one right off the bat, is like things that are completely out of the person's control.
But then at that point, the person needs to know what the resources available are to them. And oftentimes, what I find is that, I speak to my clients and let's take it down a notch. And it really doesn't have to be something as severe as a psychotic down or anything like that. I'm just thinking more like in terms of you had a loss in the family
Mhm.
and you need to just go through your grieving process, or maybe you have depression and you are having a really tough time trying to get it together. So, or maybe you had an issue with a family member, your husband left, I don't know, anything that really shakes you off a little bit emotionally. You need to know what are your options. So I think that understanding what are my benefits, that's a really important one. Secondly, who can help me with these benefits and what does that mean? So, in terms of FMLA, I can say not for everybody, but I have been able to fill out paperwork for my clients when it's pertinent. So, sometimes your therapist is going to be able to do that. Some other times you have to go to your medical doctor, go through that route.
Mhm.
People don't know that they do have short-term disability that they pay for sometimes. And if you need to take it a little further in terms of, guess what? I don't have PTO, or my company, I don't, for some reason, FMLA is not going to work for me. Well, guess what? Maybe your short term disability will. So I think that people need to be informed first and foremost, and they need to communicate with the employers as well. So another thing that I wanted to say, and you can correct me if I'm wrong, but I feel like human resources, yes, it's called human resources because they want the wellness of the employees, but they work mainly for the company. So is yes, it's a fine line making sure that the employees are happy, but HR is in place to make sure that the company is going to be thriving with their human resources. So I think that that's something that sometimes people get confused about. Um, and
I
yeah,
I think that most companies when they put in place here's a weird one that maybe a lot of people don't think, Aflac. There's companies that have
right,
yeah, that implement Aflac or that have employee assistance plans, EAPs. Uh,
correct.
so you
Yes.
can get like free therapy sessions. Some of them even go as far as free psychiatric support. Um, and
Some
Aflac with the short-term disability and with the, with the medical leaves to supplement your short-term loss of income and things like that.
And in addition, I wanted to say because sometimes we find a lot of adjustment issues happening. So it doesn't have to be, like I said, a psychotic break or anything like that. It can be you're going through a really tough time, a divorce, right? So you mentioned EAP. A lot of people don't know that some companies have legal services through EAP.
Mhm.
So yes, please communicate with your employers and make sure that you know what your options are should you need some support with mental health is one of the things that I wanted to mention. The other thing that I have found is that people tend to just let's say that you're having a problem, you're having an issue and you don't know how to resolve it and you are from your 9 to 5 schedule. So one of the things that I wanted to suggest is if you're experiencing something like this, write things down because when you come to therapy sessions, you want to be able to explain what's going on, and we may want to be able to help you how to walk through this. Like, what is a good thing to do? Do I need to take 5 minutes? Do I need to go into the break room? Do I need to talk to someone else that can support me with this? So I think that if we do those things for starters, people are going to be better with their mental health in the workplace, which is so important.
I know. For me personally, I find that a a good sign of a decent work environment is when you have people who have open door policies and it's okay for you to go in. I mean, I get approached about all sorts of different topics. Talk about the loss of a loved one. I had two of those just in the last 2 weeks. Two different employees come to me about losing loved ones. And it's often very sudden and it's unexpected and it's a huge blow. And the day of, they came to me and Stephanie, our clinical manager, and they were like, "This is what just happened. I don't know what to do. I am grieving. I am shocked. I can't work under these circumstances." And of course, I could completely understand that. Um, so that we put together a plan. It was almost like crisis intervention at that moment because these people had patients. We put immediately a plan in place, moved the patients, took over, and just did everything we could to support the individual. A good work environment is a place where you feel like the employer cares enough about things that are important to you, like your well-being, that you
Mhm.
can come to them in cases of emergencies and they will make space for you and still be tolerant of your situation. So try to maybe have a relationship with your employer where you can get to know what kind of personality they have and how likely they are to respond if you do approach them. 'Cause
Mhm.
I guess that's a good thing to know is like, okay, what am I gonna be facing if I come and sit with this person?
I think it's so important to also have a support system within your workplace, not only maybe from your employers, but with other employees. So, for example, here's one that I see a lot is poor leadership. There is definitely nothing you can do if you are under a leader that is not doing what they're supposed to do in terms of leadership, and that affects people under them, of course. So like I like to say, crap rolls downhill. Everything stems from the head. I'm serious.
It's
But
true.
I was always thinking that if we have support with other employees that are like-minded, that we can find positive aspects about the workplace with, we want to gravitate towards that. We want to make our lives a little easier that way. And I have been in that situation being an employee. And I think it is very important, like I said, writing things down so that you can talk about these things with your therapist. Another thing is taking breaks. Very, very important. If you feel like you need to take 5, you can always go outside, and don't be on your phone. Just really be out there, take a few deep breaths, and come back to the workplace. The fact that you may be dealing with some things doesn't mean that you're a poor performer or something's wrong with you. I think we all have been challenged in workplaces before, and that is all related to mental health and the way I see it, because it is all about wellness, like I mentioned before. And we spend so much time in the workplace. So those are some things that I wanted to throw out there. I think that people mainly, like you were saying, don't communicate when they're with their employers, and that is a key aspect of things. So knowingly that you may have something going on that you need support with if you're applying for a job, I think it's also important to disclose that
I
and
just
talk.
had that. I just had that happens that one of the people who had a loss, the loss came sudden because the person didn't even tell me what
Mhm.
was happening in the first place. And we were like, "Oh, we didn't even know you were dealing with that at all. And now you're losing that." And now it's a crisis for you. So like I felt like we couldn't support this person at all in any of the stages of the situation at all from the beginning. We couldn't be supportive when they first came in. We couldn't be supportive as they were struggling with it. And so we could only be supportive at the very end when things just became totally out of control, and that's when they decided to speak up.
Oh, wow.
Mhm. Yeah, and it's because they didn't feel confident in speaking up about what they were experiencing when they first came in, when they first started.
Do
They
you
weren't.
think that I'm sorry to interrupt you, but do you think that that has something to do with maybe feeling shame and thinking that, oh my gosh, if I talk to this person, they're going to think that I'm not capable of doing this job, or like that's probably what it is.
I agree. Yeah, that was the case. Um, Something that comes to mind as well is it frustrates me so much, so much. Whenever I hear, especially therapists tend to do this to themselves because we're all a bunch of bleeding hearts. I cannot stand when I hear therapists say that they are leaving a job or that they are done with work with the place where they're working because they're burned out. But the the therapist or the individual, because it can be anybody. I mean, you look at the service industry and it can be anybody, but that person will not take a 15-minute break. They will work straight through lunch. They will not take a weekend off. They go home at night and all they do is just sit in front of the TV and veg. They don't go to the gym. They don't try to like do any kind of self-care. It's just survival mode all the time. And then they turn around and they say, "Oh, well, it's work. Work had me burned out. It was because work is too hard. It's because work is too much." You put yourself in a position to be burned out. If you
Yeah.
set personal boundaries with yourself and you say, I get two 15-minute breaks and a 1-hour break, and that is going to be
Right.
like, mine, 100% mine. I will
Hmm.
close out my schedule. You do not touch that time. You don't see me. You don't talk to me. I don't exist. I'm out of here. Literally leave the building. Even if you go around the corner to the gas station and sit in your car, I don't care. But don't don't put yourself in a position where you are self-destructing, but then you say it's the work.
It just made me think about a time when I used to work in an agency years ago, like over a decade ago. And I would take my lunchtime and just close my door literally and meditate through my lunch and eat by myself in the quiet of my office because I needed that space. I'm an introvert. And I had a coworker telling my boss that I was strange and make sure that you didn't hire a serial killer or something. And so I had to clarify, well, no, guys, not that I mean, not that I had to, but I just felt like that was funny. And I'm like, well, literally, I'm meditating and eating my chow. So let me go ahead and enjoy that. So, whatever it is for the person, you're absolutely right. Self care, I mean, that's just across the board, but especially to avoid that burnout in the workplace is whatever you're doing outside work or within work with your breaks, respect that and take
Yes.
care of yourself. Very important. I wanted to throw a few numbers there, if I may.
Sure.
I don't know exactly how accurate the statistics are going to be, but apparently 25% of workers identified their work as a main stressor in their lives. 1 in 5 adults in the United States experience some sort of mental health related issue, and that affects the workplace. And 83% of workers have experienced stress or anxiety due to work related situations. So if we look at those numbers, again, it's not, oh, I have depression. Oh, I have anxiety. Oh, I have bipolar disorder. Oh, I have OCD. No, we're talking about anyone. This can happen to anyone. And it relates to health, mental health, because you spend so much, excuse me, goddamn time at the workplace that we need to make sure it's balanced.
I agree. And I do think that people have an interesting way of defining what they consider stress and what they consider traumatic work experiences.
Yes.
I have a patient that unfortunately, because of some insurance stuff, we had to take a break from visits, but he was always very consistent, and we talked about his job every single session. And
Hmm.
here's the crazy part about this. He loved the company he worked for. Um had worked for them for a long time, but he got transferred to a department that basically isolated him from most human contact. And that was the kind of his bread and butter. Like he loved socializing, he loved helping people more than anything. And
Hmm.
so the minute that he got moved to this new department, he started to see his quality of life going down, and he started to see his mental health going downhill as well. And he became a lot more anxious. His natural tendency to be anxious started to get even worse. And he did reach out at my advice multiple times to his managers, but the managers kept insisting on leaving him in that department. And so what did we do? We started to discuss the possibility. Two things came up. Number one, trying to enrich his life through social activities outside of work, by going to the gym, by going out with friends. And then the second thing that we discussed was, there comes a point where if you're a really good employee and you're actually exceptional, because he was a truly exceptional employee, and you're openly telling your management, this is not conducive to my mental health. Like, this situation that you have put me in is actually hurting my mental health. And I can give you solutions, because he was walking into, obviously guided by a therapist. He was walking into the office with a plan. He was like, I can be so much more productive if you put me out here. I'm willing to do this. I'm willing to do that. And so he wasn't coming in just to complain. He was coming in with answers. He wasn't just asking for a handout. And we discussed, like, if you're an employee who is a good performer, who is coming in with answers, and your management is not listening to you, then start considering another company that might, appreciate what you're willing to do, more than the one that you're at right now. So we discussed those two possibilities, and he put both of them in place. He did start going to the gym, but he also started talking to his manager and looking at other possibilities too.
Yeah, thank you for mentioning that because sometimes flexibility is something that is not present in the workplace. Um, so I also have had some experiences where I know something is not conducive for the person, but they have to do it because that's what the workplace requires from them. And that's when, I mean, this is just for people who are looking for employment. You got to know thyself. You got to know that if you are not comfortable with dealing with people all day long because you tend to get tired and you're more introverted and you prefer to do data entry, please don't be looking for employment where you have to do the opposite of that, because I know we all need money, right, to live. But let's be mindful about, am I a good fit for the workplace? Is this workplace a good fit for me? Because then we find problems later on down the road with things that cannot be changed due to lack of flexibility with the employer. And like you said, some employers are not really willing to work with the employee.
And ask
So
questions. Ask questions when you do the interview.
yes,
Like, how
yes.
much will I have to work with people? Or like if you are an extroverted, like my patient is, how often will I get an opportunity to work with the clients that are coming into the store? Will I be able to be in a role in a position where I can interact with other people and I can be of help and I can be of service? Because that's really important to me. Like, share the things that are your priority, share the things that most people are so focused on the bottom line, and they just see the dollar sign and they're like, well, this is
Mm,
good enough and I need a job. And so like, and I know that you get to a point where you sometimes you're a little bit desperate, but
yes.
remember that if you throw the net out there wide enough, like you should be able to pick out of, two or three options, and maybe they won't be perfect, but you can pick the best one out of the imperfect ones. You pick the one that fits the most.
Yes, and I also think that at this point in human history, things are much better in terms of doing things differently. It doesn't have to be the 9 to 5, Monday through Friday. I think the UK just passed a law, but I don't want to say this 100% because I think this is the case, that they're going to do a 4-day week, work week
Mhm.
instead of 5-day. So I think these days, there's the possibility of doing hybrid work or doing remote work, or so yeah, but it all boils down to communication, right? And speaking and making sure that I know my benefits, that I'm telling the person that I'm interviewing with, this is what's happening with me, or I go to my boss and I go like, hey, I'm challenged with this aspect of life right this moment. How can you help me?
Mhm.
Um, Now the thing is, what happens if you don't trust your boss? If they're opening up, yeah, that's an interesting question. So at that point, I really,
You know, the funny thing is, I feel like I have a pretty decent relationship with my employees, but they all still see me as the boss. And I do know that sometimes I come across as a very tough person, but no matter what, they always tell me like, "Well, you're still the boss. You're still the person that signs the check." So I don't always feel comfortable coming to you. If you have a decent management team, you should not have to go straight to the big boss. There should be people under that you can go to, that you can establish a relationship with, that maybe you feel more comfortable talking to. It can be a manager, it can be a floor like a floor manager, or a whole corporate manager, or something like that. Or even someone in HR. I know that HR is not necessarily like the first place to start, but you may know people there that you're familiar with and that you
right.
have a relationship with, that you can be like, hey, you know what, can you tell me some of the things that I can do in this company? Like, what are you guys offer? Blah, blah, blah. Has a conversation. So
Mhm.
you don't have to go straight to the
To-
top management, but start by, working with your local team. At least if you're starting to explore what are the options, and also get to know um, what are the options within the company, because sometimes there's hiring that's happening within the company.
Right.
Right?
Yes.
Where you might have, like, one position that you're becoming very burned out on, but this other position is opening, and you're like, "Man, I really wanna give it a shot because I think this would be much better for my mental health."
And burnout can happen in so many ways because it could be the right fit for you. But in terms of, like, for example, the helping professions, like what we do for a living, if you're not cautious enough to try to change things for yourself a little bit, you may find yourself after 3, 4 years post graduation being absolutely burned out and not able to help anyone else. So I think burnout shows in different ways, or it could be, I have been given this task by my company and I can't handle this, so I can't cope with it. not having enough support. I mean, burnout can present itself in so many ways. So I think being aware of those things, right? And trying not to power through just because I want to white knuckle through this and I can do it. Maybe just recognizing, hey, I need help, and let me see what resources I have. I think it's so important to do that too.
Yeah, get to know yourself. That's a good point there. Is like, understand your triggers, understand the area,
Yes.
yeah, the areas of your life where you have certain um mental health deficiencies, and it's not necessarily because, oh my gosh, you have a mental illness. It's not about
Mhm.
that. It's that, for example, I am a very, very introverted person. The reason why we do a podcast that's audio is because doing the videos was damn near killing me. Like I could not stand it. And I know personally that if I have 4 or 5 meetings in one day, at 5 o'clock, I have to clock out and I have
Mhm.
alone. I have to be alone. I have to go and maybe read a book, maybe go to the Starbucks and sit down and like just listen to music. I have to get away from people. And I'm a
Mhm.
therapist, for goodness sakes. But I know that side of myself. And I know that when I go several days without doing that for myself, I start to isolate in an unhealthy way, and I'll start to self sabotage. And I've identified those aspects of myself, and
Mhm.
I'm, for my own sake and for my own mental health, I have things in place that prevent me from getting to that point so that I can start there.
That's yeah, you're absolutely right on point with that. So know yourself is key. I strangely enough, I'm also introverted, but I love to show my face everywhere. So anywho, not this morning, because if you guys were able to see me, she caught me off right the same way I woke up this morning. But also I wanted to say a couple more things. If you feel like you are not in control of the situation because it doesn't depend on you, and you've exhausted your resources, you talked to people, you did what you thought you needed to do, you know your benefits. There are little things that you can do to make your life a little easier in the workplace. Does that mean maybe can I come in a little later and leave later? Because of commute times. I have had that one, right? Like, I can't stand being in traffic for an hour. This is driving me crazy. I hate my life. Well, can you talk to people and see if you can somehow arrange a different schedule for yourself so that you don't have to sit in traffic for an hour? Little things like, maybe you have these coworkers that you click with, and you sit down and you have lunch and you laugh with them and you just have fun with them. Or if you can walk outside, if you have a beautiful scenery in your office, why not just go ahead and take a quick walk around? Or talk to people within the office that you like to, but it doesn't have to be related to work. So those are little things that I feel you can implement within the workplace if you cannot do much about the situation altogether. And outside of work, please, please, please make your life as fun and as enjoyable as you can. If you like to go and I don't know, have brunch with friends on Sundays, please go ahead and take advantage of your free time and recharge your tank before you come back to
I
work.
agree 100%. 100%. Anything you can control, anything that you can actually have a say in, make sure that you use that control and make sure that you use that ability to manipulate the situation for your benefit, whether it's to empower you, to ease your mind, to de-stress you, to just anything that you can do. um, those small victories are going to make a huge difference on how you feel emotionally at the end of the day. So,
Perfect.
okay,
Complete agreement.
I so I think we've gotten just about everything we needed to on this topic, and I was really excited about it because I I hadn't thought about it very much, but we all, like the majority of us work, and the majority of us have some sort of experience like this, and we all need mental health, and we definitely all need mental health at work. So thank you so much for the idea, Dr. Ana Maria. I loved it. I hope you guys enjoyed our conversation, and as always, we invite you to Share with us your comments, your thoughts. If you have any suggestions for another topic that you might like for us to explore with you, feel free to do so. And we hope that you have a wonderful rest of your week, and we'll be talking soon.
Thank you, Yalili.
Thank you. Bye.